Hi everyone, Dr. Amy from Pain Free and Fit and Posture Size. Today, great exercise for those of you with spondylolisthesis and or degenerative disc diseases called the Wobble Board A to P Stability Training Exercise. Hope you enjoy. So, for today's exercise, training the stability of the lower back with either spondylolisthesis or degenerative discs, we're going to be using a wobble board. You can get a commercially made one like the fitter board that I have here, or make one at home yourself with a simple piece of plywood, a 2x4 or 2x3, a couple nails or screws put in. The idea is we want to be able to have something that wobbles a little bit back to forth. Now, important with wobble board training is you want to be able to learn what your unique RPI is, which is your body's ability to correct its tendencies to go into bad posture, to go into abnormal mechanics. All of us have unique postural tendencies, stability problems if we have lower back pain that are unique to us. Every person with lower back pain, whether you have spondylolisthesis, degenerative disc, or any diagnosis, no exact diagnosis is ever the same. It's based on the individual. So if you don't know what your reverse posture isometric is, RPI, go to either the Posture Size or the painfreeandfit.com website. Learn what that is first, because otherwise if you try to go onto a wobble board like most people in most rehab facilities or gyms, and you try to balance on that board, if you have a tendency to lean, let's say, to one side, that's only going to come out during your balance training. You're going to go to your strength or your habit. If you have a tendency to hip hike on one side, if you have a tendency to undercontract one multifidus muscle, overcontract one abdominal oblique, have a tendency to torque or twist slightly on your spinal vertebra, that's going to come out as you're seeking to balance on that balance board. So you have to know what that is so you can avoid that and focus on that with your balance training. That's the whole idea of balance training. You got to know what your RPI or neutral spine position is first. So check that out, get that down before you do this training. On to the program. What we're going to do with this exercise is we're going to use the balance board in a front to back or anterior to posterior A to P direction. You can do it next to something, holding onto a bench, a piece of cardio equipment, or a rack like this. You're going to position yourself so that your ankle bones are slightly behind the center of the board. Your normal gravitational line from your ear, your shoulder, your hip, your knee should pass just in front of your ankle. So that's why you want that pivot point just in front of your ankle bone, within an inch. You're going to make sure your feet are straight, you're balancing all four quarters, and you're going to engage your RPI, that unique spinal position. If you need to hold one hip down, you're going to be thinking about that. Tail up or tail under, you're going to be thinking about setting that. If you have a tendency to engage one muscle more than another, engage the right muscle, relax the overactive muscle. We're going to make sure that for all of our stability training, we're working within 1/4 of an inch of sway or wobble. If during any training you're wobbling more than 1/4 of an inch with your body, you're likely to open up your chances for injury. It's just too much motion. You can't hold the neutral spine. So the amount that you touch on or tap onto the wall or support yourself needs to be enough where you feel a slight instability, meaning the wobble board has a little wiggle to it. Your body's maybe swaying a little bit, but it's less than 1/4 of an inch. If you have too much stability and you're perfectly straight, no good. You're not training anything in terms of balance training or stability training to perturb balance. So you want to then lift off a finger or two. If you can eventually do this exercise holding on with nothing except your feet to the board, then you're going to progress to eyes closed training, which makes it worse because when you take the vision out, you rely on the proprioceptive input from your spine, from your lower extremity. All those sensory nerves are sending messages, and you're coordinating that at the spinal cord level to produce a reflex of motion, a muscle contraction to balance back and forth. Now, here's the key. That's the basics of how we're going to do it. Now the specifics. When we're on that balance board, if we have a spondylolisthesis case and our problem is spinal pain, low back pain with extension, when the tail comes up or when we arch backwards, when we increase that arch, on this board, you need to emphasize those abdominals contracting, because the abdominals contracting is going to prevent the spine from extending, especially when your toes go down. That's when extension is going to happen. Extension is not going to be such of a problem when the heels go down, because when the heels go down, the arch in the back typically decreases. This position is going to be more aggravating for disc problems, degenerative discs, herniated discs, disc bulges, because it creates a flexion or a decreased arch or bending forward on the spine. Again, we're working within only 1/4 of an inch, but the beauty of this exercise is if you have your RPI engaged and you're watching out for that tendency to arch your back as your toes go down or flex your back as your heels go down, you're going to be able to prevent that as you maintain good upright posture. You can tap on and off and maintain focus on your RPI. After a while, your spine will remain absolutely stable. There won't be any motion in it at all, but your ankles will be moving a little bit as you teeter back and forth. So that's common. Beginners are going to have more of a sway with their upper body. After you get used to balancing on the board with the RPI, your ankles will be able to absorb most of it. Even with that, there may be a slight little bit of motion in that spine. And remember, it doesn't take a lot of motion for injury. Sometimes you're talking about 1/8 of an inch of motion the wrong way is enough to hurt yourself. So that's why we want to make sure we have that neutral spine position, your core engaged, you're ready for a punch, your spine is tall, you have a stable spine. Any motion that's happening is with the head and neck or the ankles. That lower back, the goal is to remain stable. Once you can take your hand away and remain stable and flat with your RPI, you then can close one eye at a time, both eyes. Again, you may have to tap on and off to be able to get used to that. And eventually, you should be able to stabilize yourself with your eyes closed, holding nothing except contact with the board. The more you practice this is an exercise that you can do every day, multiple times a day, the more you're going to be engaging your spinal stability muscles, your ability to avoid those flexion and extension forces that aggravate spondylolisthesis and degenerative herniated bulging discs. And you'll be able to utilize that in a more reflexive manner, meaning less conscious when you're moving, when you're working out, when you're playing sports, when you're working throughout the day. If you slip, someone pushes you, you're going to have a quick reflex to go into that neutral spine position. You won't even have to think about it. The board is training that reflexive nature, that reflexive safety net of your muscular core to hold yourself in a safe position. That's invaluable in terms of preventing spondylolisthesis and disc pain. If you like this video on spondylolisthesis and degenerative disc disease, feel free to subscribe to our channel. We got a lot of great videos out there for you. Questions or comments, write in. As always, I'll do my best to answer them. Thumbs up below to help me share this valuable information with other low back pain sufferers. And remember, if you're looking for a custom program to figure out what your unique mechanics are, what your tendencies are, what your deep biomechanical errors are that are actually causing and perpetuating your lower back pain, check out our fast track programs. We have one for spondylolisthesis and one for degenerative discs at the painfreeandfit.com website. Has all the self-body analysis, all the corrective exercises, balancing exercise, strengthening, endurance exercises, and it takes you step by step of how to build a self-rehab program to get yourself back into heavy working out sports without aggravating your lower back. I hope this Wobble Board AP training helps you with your chronic lower back spondylolisthesis and degenerative disc pain.